My name is Miss Linda Gaki, a speech and language pathologist. Today is World Autism Awareness Day. And now we need to know what is autism as we are trying to create awareness today. Autism is an developmental disorder that is characterized with 3 key patterns, which are language and communication, social skills, repetitive interest, restricted interest, and sensory processing disorders. Autism in a layman language, it's the difference in the brain. And this difference in the brain makes these individuals, they present, or it makes them present in different abilities, in different wants, and in different needs. Autism is a spectrum. That means it has diverse range of presentation. When you meet one child with autism, you have only met one child with autism. If you meet one individual with autism, you have met one individual with autism, because all of them are different. We have delay in speaking, we have loss of words, where a parent will tell you, my baby was saying these few words, but now the baby can no longer say those words, a regression in their words. We have echoing and jargoning of words and scripting of information. We also have nonverbal cues. Children with autism, they don't notice sometimes nonverbal cues and gestures. They also have challenges with high-pitched voice sometimes, and sometimes low-pitched voice. Sometimes they master, they can master numbers, they can master letters, they can master colors, but they still cannot initiate conversations. And then you realize they have, for them to learn, then you have to repeat some few things. When you're doing speech therapy for them, you have to keep on repeating some few things here and there. There's a lot of repetition, there's a lot of modeling of communication, for you to be able to support them. So who does the Mendeko evaluation or Mendeko diagnosis of children who have autism? Visit your pediatrician doctor if they are able to do diagnosis for autism. Neurodevelopmental doctors are also well equipped to do assessment or diagnosis for children who have autism. The research says that it can be done from 18 months. Starting from 18 months, if you see some behaviors that you feel the need for evaluation, you can see pediatrician or neurodevelopmental pediatrician starting from age of 18. Education evaluation helps these children the teachers to know where to place these children in school. They're able to know how to come up with individualized education plan for these children. So it's also important to do an education evaluation for children who have autism. So after Mendeko evaluation, it is education evaluation. Some say that children who have autism or people who have autism are not intelligent. That is a misconception. They also say children who have autism cannot maintain eye contact. It's a misconception. Not always. It is a difference, but not always. They say children who have autism, they don't pay or they are not keen. That's a misconception. Children who are autistic or individuals who are autistic are very keen. And they say, another misconception, that children who have autism are not empathetic. No, that's a misconception. A big number of them are empathetic. They also say children who have autism spectrum disorder, they don't make progress. That's a lie. When you do interventions, when they see the therapist, they make a wide range of progress. They achieve communication skills. Some also achieve sensory processing disorders, balances. They achieve social skills, They can live in a way that they become more functional. How do we create awareness of autism? It's by accepting individuals who have autism. Know that the individuals who have autism are brain different, and all of us, also have some differences with how we reason. We have differences on our needs. Sometimes our differences make us also need, want, need to be helped, to be supported. And that's the same with autism spectrum disorder. So this season and years to come, for we to create awareness on autism, please can we accept children with autism or individuals with autism by giving them the support they need. And as here in Karen Hospital, we encourage on early intervention, seeing occupational therapists, seeing your speech therapist, seeing your physiotherapist, seeing ABA, taking children to school. There are so many interventions that you can do for children who have been diagnosed with autism spectrum disorder. And the earlier you start, the better it is. We have a variety of services that can support individuals with autism spectrum disorder. We have speech and language therapy, we have occupational therapy, we have pediatricians who can do evaluation for children with autism. We have ENT clinics here in Karen Hospital. So in case of these services, you can call the numbers below for you to get any of those services, and they're readily available here at the Karen Hospital.